I'm Dr. Sharath, cosmetic plastic surgeon at KIMS Kondapur, and today I'll be speaking about gynecomastia. Gynecomastia is a male breast enlargement, which happens in young pubertal males, and sometimes it could have underlying reasons in certain individuals with certain medications producing these problems or hormonal imbalance. In individuals who have tried physical exercise for this enlarged breasts in males, and they have not had any benefit or unresolved enlargement, would be an indication to have this surgery, provided they've been assessed properly and there are no other underlying conditions which had produced this gynecomastia, which have led to this gynecomastia. An answer to this question would be, we look at pubertal spurt, and if there is any hormonal imbalance, excess of estrogen in relation to testosterone, or any medication which can cause gynecomastia, and assess appropriately to see if there is any testicular problems which can produce this gynecomastia, and if these symptoms are persisting in spite of adequate non-active treatment. Some individuals become conscious when they're 16 or 17 when it develops, and then they go to hit the gym. And if it is a mild gynecomastia and which with development of pectoral muscles that is not that obvious, they are happy. But if it is not, then they seek a doctor's opinion or plastic surgeon's opinion for further treatment for this. Best thing is to have yourselves evaluated with an appropriate plastic surgeon who's experienced in doing it, or who you're confident that will give you good results. Now, when you see the plastic surgeon, they'll assess your extent of the problem, and sometimes it could be either fat or the gland which hypertrophies or increases in size, producing the gynecomastia. Some individuals have unilateral, some individuals have bilateral. That bilateral means both the breasts being involved, which is more common. Any underlying medical conditions or medications would be assessed by the doctor, and a thorough physical examination is done, including a blood evaluation to make sure that there is no other problem or a biochemical imbalance. And then the surgery details will be explained to you by the surgeon, including what the procedure involves. Now, what exactly does the procedure involve? Is it either liposuction or mastectomy? As I mentioned before, it could be a combination of both also. The surgery methods are either an open reduction, wherein there is an incision along the areola, and mastectomy, that is enlarged breast tissue is excised, or liposuction by means of a tiny incision and a hollow tube, which is a liposuction cannula. It can be sucked out. The appropriate decision of using either a hollow cannula or mastectomy is taken by the plastic surgeon in liaison with you, and this would depend on the reason for the gynecomastia. It could be, when I say reason for gynecomastia, type of gynecomastia, that is it more glandular or is it more fatty? If it is more fatty, it is easier to aspirate with a liposuction cannula. Sometimes we combine both the procedures and do the surgery. After the surgery, you will be put on a tight garment for the chest. There could be a drain which drains fluid from the skin, between the skin, any fluid that collects between the skin and the chest wall. And this drain can come out after a day or two, or might remain a little longer for a few days. Now, the tiny wounds which are either in the areola or the port, which could be in the anterior axillary fold, are stitched, and depending on the suture material used, either the stitch needs to be removed or it dissolves by itself. There's a tight garment on the chest which should be used for 6 weeks. Normally, people are allowed to take bath after a few days once they are comfortable with the dressing being taken down. There could be extensive bruising around the chest because of the procedure itself, which takes about a week to 10 days for it to go. For about the first 2 weeks, we would ask you to restrict your physical activities by avoiding any contact sports. After the first week, we'll start gentle exercises and not to lift any heavy weights, which brings the pectoral muscles into action and cause any shearing. For the appropriate benefit to appear, it would take a few weeks for the edema to settle and for you to make out the benefit of the result. Improved confidence by having a more masculine appearance rather than a feminine appearance after the breast enlargement would be the most sought after benefit by people who undergo this surgery.